We are here for this healthcare extravaganza, and we would be having many interesting sessions with very esteemed speakers. So for our very first session, which would be taken by Dr. Bejon Misra, Professor Bejon Misra, who is international consumer policy expert. He has 45 years plus experience. He has been visiting professor for several universities, founder and trustee of several consumer organizations, founder director of Patient Safety and Access Initiatives of India Foundation Private Limited, publisher and edition of the Aware Consumer monthly English magazine, and so forth. And he would be talking on a very important topic, which is empowering patients through transparency. How policy can drive safer, more informed healthcare choices. I think this is the most important topic of this era, of these times, when patient attendants are looking forward for their active role in how the treatment would take place, the planning of the treatment, what is going on, informed consents, safety, etc. In total, if I call it, it would be experience is what they are looking forward for. And on such a vital and important topic, we are having a very esteemed and important speaker. May I have the privilege of calling upon Dr. Bejon Misra on stage. Sir, can we please have you on stage?
Hi, good morning. Wonderful. A round of applause for the people who come on time. Great to have you all. Yeah. So friends, first is there are some ground rules in terms of when I speak. You will not speak to each other by the side. You will look at me. You will not talk to each other. Right? Is it okay? Number two, please switch off your mobiles or put them on a silent mode. All mobiles on silent mode. And all of you have the right to stop me to ask questions. If you are not clear about certain things, please do not hesitate to stop me. You have all the freedom to stop me and ask me a question. So please keep some hand mics ready for people to ask if they want to ask me some questions. Is that okay? Yes or no? Yes. All agree? Yes. Wonderful. It's very good. So friends, I have been told to tell you all about empowering patients through transparency, how policy can drive safer, more informed healthcare choices. And what we are working towards is public and private healthcare delivery system and institutionalizing users' engagement in the quality management system, and also moving towards world's best practices in terms of healthcare delivery system in Bharat and as equivalent to WHO member countries. So here I start, and first I must tell you all, policies must consider few mandatory rules. What are those rules? The very first rule is that you have to benchmark yourself in terms of understanding how the patient has perceived the experience from your service which you have delivered. So benchmarking the service which you have provided, which is most important in terms of ensuring in order to move forward and grow. And what I have seen in Sarvodaya from the time I've arrived since yesterday, and again I wish to congratulate Dr. Rakesh Gupta ji and team for the wonderful sessions you did yesterday, and I'm sure it's going to be interesting today also. The key factor is, if you have to improve, you have to look at feedback as suggestions for improvement. Nobody complains to you if they don't have a relationship with you. Please remember this. And you always have to understand that if anybody is complaining, he is one of your most trusted person. Most of the people, data has shown, only 6% of the people come and complain on the service. Same service. 94% go and talk behind your back. And they are not your well-wishers. And I always ask you, कि आपके घर पे सबसे ज़्यादा शिकायत कौन करता है? आपके घर पे सबसे ज़्यादा शिकायत कौन करता है? Wife. So is she a kind of a deterrent to you, or she is your most trusted friend? Most trusted friend. So wife यदि करती है, तो it means that she wants to see a change in you, and she sincerely wants a change in you, and she feels it that she has to tell you that. So always believe that the patients who come and tell you something and tell you where you're going wrong is actually a step towards improving your quality of service. You should always encourage. In fact, you should take out a toffee and give it to that patient and say that, have this. This is my gift to you that you have come and complained to me. Give a gesture to that person and make that patient feel that you felt that she is very important or he is very important to you. So the most important next action is institutionalize this whole system and learn to incentivize. You see, it's very important. Sangeeta, come. Be seated. Sangeeta is part of my board, so I had to stop to greet her. So she's a very honorable member of my board. She guides us in many issues, and we have been working together for many years. So friends, incentivize doesn't mean that you just give large amount of money. Incentivizing means you need to recognize. You need to show some gesture so that people feel very wanted. Yes, if I do something, my management recognizes me. There is always a system. There is always a system. Many organizations I've seen. The most popular person or achievement award every month, every week. As with some, but there is no transparency. Everybody must know how did you arrive at that best. What was your criteria? People want to know that. Otherwise, they start thinking that, it's a biased thing, जो सबसे ज़्यादा चमचागिरी करता है, boss का उसी को दे देता है. Am I right or wrong? Is this not the general feeling? So you have to always become very transparent. How do you select? Who selects? Whether it's a neutral body or not. Whether there is any kind of a conflict of interest or not. You have to understand that, and that's very important. The next most important aspect is that there are 8 golden rules. In terms of what are the expectations, the top expectations. Since yesterday we've been talking about it. The first most important expectation is standard. And standard, when I say, it doesn't mean that NABH. It doesn't mean BIS. It doesn't mean, JCI. Standard means what you would have made for yourself and made it public. Standard means what you have decided within yourself, within the organization, and promise to the patients that this is what we follow when you come to my hospital. And these are my standards, which is more than the law. Because whenever you do any kind of a voluntary standard setting exercise, you have to understand the minimum benchmark is the law. So whatever is the law in the country, you have to follow that. But what you are promising to the patient is more than the law. And that is what you have to make it public. That when you come to Sarvodaya, you get more than the law. And when you get more than the law means what? In a tangible manner. So that's very important. So standard choice, as I said yesterday in my opening keynote address, that when I come here, things should be done in the manner I feel is the best I want it. Whether I want to go to Ayurveda, I want to go to homeopathy, I want to go to allopathy, it's up to me to decide as a patient. And all doctors should understand that that is the kind of an opportunity you should give as a choice to the patient. Giving all the facts and figures. Accessibility. I should be able to access it the time I want, not at the time you want. So it should be made accessible at a time when I want. And when you talk about 24/7, you have to make sure it is 24/7. Non-discriminatory. There cannot be, some kind of a quality of care for some set of people and another set of quality of care for some other set of people. No. It has to be non-discriminatory. There has to be transparency. Friends, that is what I am supposed to talk to you all is. Transparency always comes in when you feel that whatever I am doing, I need to make it accountable. If you are not accountable, you can't build relationship. If you are not transparent, you can't build a relationship. And you have to understand that transparency actually makes you more efficient. It makes you more kind of a competent. Many a times I have heard people, no, हम ये चीज़ नहीं बोल सकते, हम इतना नहीं बोल सकते, नहीं. हर चीज़ का एक सीमा होता है जिस ढंग से क्या बताना चाहिए जो वो समझता है उसके भाषा में. You always have to speak in a language which people understand. You won't believe it. When I went on a study to UK and I visited their hospital, the patient charter was made in Tamil, Telugu, Urdu. And I asked them, why did you do it in this language? They said, we have citizens in our country who only know that language. How many of us understand that we have to make communication in a manner which the other side of the person understands, so that there is a complete give and take in terms of understanding? है कि नहीं? आप तो बहुत serious लग रहे हैं. Is it very difficult? Easy to understand? Good. Keep a smiling face. So, accountability, information, and quality of service. These are the golden rules, which we all have to understand. Whenever you look at a patient, you should look at these 8 factors and then approach the patient in that manner. Creating effective tools to ensure services are transparent and accountable to the user. So, when you say something, it has to be made tangible. And in order to make it tangible, you have to develop tools and techniques. And simple tools and techniques, not very complicated, not highly technical jargon and things like that. Very simple. Like I saw in Bangladesh once. You go to a hospital, when you're coming out, they give you 3 coins. One is red, one is yellow, one is green. And then they tell you to drop it in a box. And at the end of the day, they count how many greens have come, how many yellows have come, how many reds have come. If there are too many reds, there's an alarm. If there is a good number of greens, people all smile. So it's very simple. You don't need to write. You just need to give them. And not even tell them that somebody is looking at you. They just drop one of the 3 coins into the box when they're going out. So you have to make tools very simple, easy to understand, easy to implement. And you have to conduct, in a regular manner, in terms of how to take care of when things go wrong. Usually complaint redressal, again I am repeating for you all. Complaints redressal is the backbone of any institution to grow. And I had the opportunity to talk to your managing director yesterday, 1-to-1. And what did I learn from him? That was the first time when I was meeting him. He always gave stress, and he stressed the fact that patients are important. And again I'm repeating, first hospital for me in my 45 years of career who has conducted a 2-day seminar completely devoted to patients. So one round of applause. You see, what I want to tell you all is, that means the top team is serious. And when the top team is serious, it trickles down. Then everybody becomes serious. And we have to develop certain tools and certain techniques in capturing this feedback from the consumers, from the patients, and also make it public, which is very important. Please remember this. We all make posters, we make audio visuals, we make many, but it has to be in a language, as I again repeat, which the other person will understand, which is very important. You know, you can make it in English, but you have to understand that you will have such kind of gestures which anybody can understand. And that is very important. So friends, institutionalizing user focus in quality management system is paramount. You know, you have to develop a relationship with your user groups. You know, हर समय कभी भी आप दीदी देखते हो कि कुछ लोग बैठे हुए हैं, वेट कर रहे हैं to get the turn. Get them engaged in certain things. You know, you must have certain audio visuals. You can have certain, you know, making people fill up certain forms, and don't make them fill. You have your people go around people to ask them, what do you feel about it? How did you feel when you came in? You know, the most important thing is the first impression. Most of the time I have seen the hospitals fail because they have not trained their people who are at the gate to receive you, who are security guards, who are most of the time outsourced. They don't train them. That the first thing you should train them is when somebody comes, you have to receive him with a smile. You have to ensure that the person what is looking for, he doesn't have to go to the reception and stand in a queue. Right at the gate he comes to know where to go, how to go, in what manner to go. And it's very, very important because the first impression is the best impression. You have to make sure, because people come with emergency. People come here not for entertainment. But when they come here, they must be received in a nice manner. You see, and that is very important. So friends, we have to make sure that when you do this survey has to have 5 very important components. Quality of the object, that is the technical quality, quality of the process, quality of infrastructure, quality of interaction, quality of atmosphere. See, I'm not getting into the details because I'm just giving you the framework because there's a lack of time and we started 5 minutes late. I want to finish on time. Okay? So I'm just trying to just tell you all some of the factors which you should, when you're developing a tool or you're developing a feedback, what all you should ask for. What are those areas you should ask for? So the next step, agree on a user satisfaction design and methodology for the hospital. Identify the key players. Please sit down, please sit down. Wherever you get a seat, you just sit down. Don't disturb, otherwise. Identify the key players within the user groups to initiate a dialogue between the various stakeholders. I always feel that you must have a patient advisory group in every hospital. And they have to be a neutral body. They have to be people who are not part of your hospital. They have to be outsiders. Have you ever tried to find out which patient comes the most and most frequently to your hospital? That's very important. The person who comes the most to you, that means they have the full trust in you. Identify them. Have you ever called a patient who's come to your hospital that when you have gone back, how are you feeling today? Very important. Extremely important. It will create that wow factor. Oh, I didn't know that the hospital calls up even after I coming back home. I'm sure you all must be practicing. I'm sure about it. Because the hospitals which grow, they adopt these processes. I learned from them only. That if you have to grow, you have to create a wow factor. मजा आ गया. You know, बहुत मजा आया. सर्वोदया गया, हम ट्रीटमेंट करके आए, 7 दिन के बाद किसी ने कॉल किया और हमसे पूछा कि आप कैसे हो. कभी भी कोई नहीं पूछा मुझसे. These are small things which matter a lot, you know, to build that relationship. And friends, I'm running out of time. Provide leadership to build awareness and quality, which I said yesterday, and I'm again repeating it to Dr. Rakesh ji, that huge amount of your budget should go on awareness building. It should go on building awareness, empowerment. Because when you empower, then you will see which is the most fast moving activity within your organization. Because they will make a choice, an informed choice. And making choice and giving that empowerment to the patient means you are growing. Let me tell you that. Nobody can stop you. And that is very important. And of course, friends, as I said, that evolve responsibilities in the processes and always develop some kind of a role and responsibility within each stakeholders. Don't make the patient feel that they are not a stakeholder. They are also party to your growth, and keep them engaged with you. So I think I've come to my last slide. The bottom line is awareness. Again, I'm coming to that. Awareness, awareness, awareness. Willingness to improve. You have to get deep into to find out where you are going wrong, what people are not liking. Don't try to pat your back all the time. Always try to find where you are going wrong. प्लीज बताइए, ऐसे करके पूछना है पेशेंट्स को, प्लीज बताइए क्या आप एक्सपेक्ट कर रहे थे, क्या नहीं मिला, क्या नहीं मिला, बोल के जाइए, एक चीज बता के जाइए. Insist on that. Then only you will be improving. Attitude. The attitude has to be patient-centric. Knowledge. Constantly. इसलिए हम पूछते हैं, आपके हॉस्पिटल में लाइब्रेरी है कि नहीं? लाइब्रेरी है तो कितने लोग जाते हैं उस लाइब्रेरी में? क्या करते हैं वहाँ लाइब्रेरी में जाके? आप हर एक व्यक्ति को वो डेडिकेटेड टाइम देते हो कि नहीं, टू गो टू द लाइब्रेरी एंड डू रिसर्च और टू स्टडी एंड टू मेक देमसेल्व्स नॉलेजेबल. और ये सब जो इवेंट करते हैं आप, it is actually to update you people about what is going on in the country, and that is what is very important. Resources. And resources doesn't mean only money. Resources means the human factor. The main is, that all your staff, they are as important as any clinical practitioner also. Everybody, even the doorman in that door who is opening the door for the patient, is an important component in your hospital. You must remember that. You have to engage with everybody. And that's your resource. And of course the culture. You have to build that culture. The culture is what patient is always first. Patient is always first. And why? Because we all live out of him. The money which we are getting, whether it is taxpayers' money or it's my own out-of-pocket money, don't forget your salary, your amenities, all are coming out of that money which he is paying. Always look at that person as the most important person in the link in terms of giving you that resource. And if that person is happy, sorry, we started on time, unfortunately. So you see, the point what I am making is, you have to build that culture. It's very important. I was telling Saurabh that, I always make it a point that if I have to start a session at 9:30, I have to start at 9:30, not at 9:30. Because the person who has come at 9:30, I want to respect that person because he is very important. A round of applause to all of them who came on time. Thank you very much. Thank you very much. So friends, of course, as I can see that the framework is such that I'm sorry you can't ask questions. My time is over. Hope to see you all again. And I'm sure I'll see you all again when you can ask me hundreds of questions. Thank you very much.
Well, I'm short of words with what I've heard, and sir, I would request you to please stay back. And such wisdom, fortune of intellect and experience is what we have heard right now. I would request Dr. Rakesh Gupta to please come on stage and felicitate Dr. Bejon. Every sentence had something which was so important for each one of us.